Hello everyone, welcome back to another one and welcome to part 2 of this general practice series. So last video I discussed kind of the ins and outs of my time in Ennis and what I did kind of on a day-to-day basis, and in this video I'm going to be covering some of the interesting patient conditions that I came across over my 18 weeks in GP. So I'm going to start off by saying that I'm obviously not a doctor and this is not medical advice in any way, shape, or form. And I know this video isn't for everyone, but if you are interested in learning some basic medical conditions, I'm going to try and keep this as brief and simplistic as possible with not too much detail. So first of all, I dealt with a wide variety of patients of many different ages, from newborn babies to patients in their 90s, and I think that's one of the more interesting aspects of general practice or family medicine. So on a general note, I'd say the most common system that I came across in GP was definitely the respiratory system. Patients would have a number of different complaints like wet or dry cough, chestiness, sore throat, runny nose, maybe hoarseness in the voice, shortness of breath, things like that. I found quite a few people had asthma exacerbations, which I was a bit surprised about, but it actually makes a lot of sense. And I found for a lot of these conditions, patients either needed a higher dose of their medication, a different type of medication as a whole, whether that be inhaler, oral dose, etc., or some individuals were actually not even taking their medication properly. And what I mean by that is, if it was an inhaler, for example, maybe the patient didn't know how to actually use the inhaler properly, and that was leading to asthma exacerbation. So a lot of times I actually had to show patients how to properly use their inhaler, and I think we got good benefits after that, and the patient started feeling a lot better when they're actually taking the inhaler properly. Now, I hate to bring up the C word, and I know things are a lot better with COVID now than they were before, but quite a few patients still had COVID or were recovering from COVID. And I learned a lot about the new antiviral COVID medication called Paxlovid. I remember I had a patient with significant chronic kidney disease, and one of the contraindications to using the new medication was significant renal impairment. So I remember the patient had really bad COVID. We were thinking about giving him this new medication, but unfortunately we weren't able to because of his kidney disease. So definitely really cool to learn about that new drug and see how medicine is advancing. It was really cool to deal with the pediatric population as well. I didn't have a lot of experience dealing with kids, but very cute. A lot of them liked coming to the doctor's office, so that was really sweet. And they had things like tonsillitis, the flu was very common when I was in the practice in the fall, ear pain, things like otitis media, and obviously because they have weakened immune systems, they're more prone to these types of infections. So dealing with a lot of kids on a day-to-day basis, but it was definitely a really good experience. Now, a lot of the patients also had GI related issues. So when I say GI, I mean gastrointestinal system. So things like stomach pain, heartburn, nausea, vomiting, cramping, bloating, constipation, diarrhea, things like this. Patients had quite a few urinary complaints, and our best friend for that was always the urine dipstick. So that's just a strip of paper that we dip in the urine and can tell us a lot about signs of infection, kidney impairment, glucose levels in the urine for patients with diabetes, etc. So for women, the most common complaints were related to urinary tract infections. Common complaint for males, particularly individuals above the age of 50 years old, was related to something called benign prostatic hyperplasia, where the prostate in the male obviously enlarges and patients can develop symptoms such as frequency, urgency, hesitancy to go to the bathroom, as well as the feeling of not being able to fully empty their bladder, going to the bathroom more at night, and weakness of their typical urinary stream as well. A lot of our consultations were for CDM patients, and that stands for chronic disease management, and it's exactly what it sounds. It's patients usually with a number of different chronic diseases that can range from diabetes, so individuals with high blood sugar, either due to inadequate insulin production or insensitivity to insulin, hypertension, so high blood pressure, high cholesterol levels, osteoarthritis, and COPD was another common one, chronic obstructive pulmonary disease, where patients have trouble getting air out of the lungs, so it's an obstructive condition. There are a number of other conditions that I commonly came across, things like headaches or migraines, back pain, general fatigue, which could be a result of many different things, sinusitis, so inflammation of the sinuses in the face, which can cause quite a bit of pain. I commonly had women come in for hormonal replacement therapy or HRT. I also had a bunch of perimenopausal women, so women right around the menopause age come in with a variety of different symptoms such as hot flashes, increased sweating, decreased sleep. There are a number of dermatological conditions that I came across, such as ringworm, and a lot of people don't know that ringworm is actually a fungal infection. It has nothing to do with worms. Just thought I'd put that out there. I came across basal cell carcinoma, for example, which is a cancerous skin lesion. I came across seborrheic keratosis, which is a non-cancerous skin lesion. I think about all these conditions. I'm like, how do I tell you guys about all these different conditions in a short video like this? But I guess I just decided for the rest of the video that I'm going to focus on some of the more memorable conditions that I came across. Now, probably one of the more interesting patients that I came across in my entire 18 weeks of being in general practice was an individual who was diagnosed with malaria. Now, malaria is a hematologic infection, so infection of the blood, transmitted by a mosquito actually. It's actually not common in this part of the world, in Ireland or in North America as well. It's more common in Africa, and that's actually where this patient's family is from. So what happened was he went back to his home country in Africa. He actually went back without taking the prophylactic anti-malarial medication. And this is pretty crucial when you go back to your home country in Africa if you live there, because it prevents you from actually getting the disease. So he did not take the medication prior to going back to Africa, and then he came back to the GP, had some vague symptoms at first, like headache, fever, chills. He had some muscle pain and some numbness and tingling in one of his arms. And we ended up doing more blood tests, and they actually did a blood smear after we got more of a travel history about where he's been, and they diagnosed malaria that way. So very rare condition to get in Ireland. Oh, all the lights are on now. No, I'm just kidding. It's a little dark in Ireland right now. No longer have the natural light, so a little switcheroo in the lighting department, but that's okay. Let's get back to the video. So another patient I had has a very rare neurological condition. Originally, I thought it was Guillain-Barré syndrome, which is a very similar neurological condition to what this man has, but he actually has chronic inflammatory demyelinating polyneuropathy. So I remember reading up on it after the consultation, being like, wow, I didn't realize how rare this condition actually is. So really unique condition to come across in general practice, and I was grateful that I could do a full neurological exam and see the different deficits that the patient has for myself, and also talk to the patient, learn a lot more about him. I remember I had the patient right around lunchtime, and I spent most of my lunch talking to him because he was an incredible man and really friendly and personal, and he was willing to let me ask anything I wanted about his condition so I could learn a lot more about it. That was definitely a really memorable experience from my 18 weeks in GP. I think the beauty of medicine is it really is a never-ending learning process, and I think rather than being overwhelmed about that, it's something to get excited about and really feel blessed about, that we can, study and work in this profession and really have like a lifelong learning experience. And I found that with general practice, there were conditions that I came across I'd never heard of, would read up on them at home, and all of a sudden you learn something new and are more equipped to deal with it in the future if you come across it again. So I had another patient with a disease called Ménière's disease. He actually had the classic triad, which was low frequency hearing loss on one side, so unilateral, something called tinnitus, which is like a ringing in the ear, and he also had multiple vertigo episodes, in this case peripheral vertigo. Now, unfortunately, I did have a few patients who had cancer in my practice. So one patient had chronic lymphocytic leukemia, another one had multiple myeloma. Those are both blood cancers. And one individual had something called non-small cell lung cancer that unfortunately metastasized or moved to his vertebrae, which are the bones around your spine. So cancer is something that affects many of us in many ways, and I just want to say that I'm thinking of all of you who may have a family member, friend, or someone you know who is battling cancer. This patient had something called essential palatal myoclonus, and I knew what myoclonus was before. It's kind of just a rhythmic jerking contraction, typically of the muscle, and in this case, it was of the soft palate. So this patient had rhythmic jerking of their soft palate in their mouth. I also had a patient with Parkinson's disease, and I think some of you may have heard about this condition before, but it's a movement disorder characterized by resting tremors, so involuntary contractions typically of the hand at rest, rigidity, so a particular type of rigidity called cogwheel rigidity. Maybe we can throw a video about that right here. Akinesia, so I mentioned it's a movement disorder. They have trouble moving, and also postural instabilities. I had a patient with something called Wernicke-Korsakoff syndrome, and it's the result of vitamin B1 deficiency, typically in long-term alcoholics, and it's characterized by confusion, ophthalmoplegia, so various eye difficulties, ataxia, which is issues with balance, and it's also characterized by a number of personality changes, confabulations as well, and memory loss. Now, I just want to wrap things up by talking about where I feel like I had the most growth in my 18 weeks of general practice, and I think that was when I was talking to patients who simply just came into practice because they wanted someone to talk to, whether that was because they had issues with alcohol, drugs, weight gain or loss, depression, anxiety, whatever it was. I feel like it was a real big learning experience for me talking to these patients and working on my skills communicating in these very delicate situations. And I remember a patient came in, she was about in her early 20s, she came in with low mood, low motivation, low concentration, and really wasn't too happy about life in general. And I had some really good conversations with her and followed up with her over a number of weeks while I was in the practice. And I think it was really cool and good for me to see her progression over those weeks. And I felt like I had a small part in that. And it was a really rewarding and character building experience for me. And she's a patient that I'll always remember, and I'm glad I can make a small contribution to her living a healthier and happier life. All right, so 2 last great experiences before I wrap up this video. Number 1, house calls. So we actually got to go to patients' houses to provide care for them. We'd actually leave the practice and go to their houses. So for one patient, I went in to put a catheter in, and another patient, I went to a local nunnery because the patient was a nun in the town Ennis that I was obviously attending my GP practice in. So correct me if I'm wrong, put it in the comments, but I don't think that would ever happen in Canada. Definitely an Irish thing, but nonetheless, a really, really cool experience. The last thing was something that's actually more common than you think, was speaking with a translator when taking a history off the patient. So if an individual doesn't speak English or the same language that you speak, you'll often have a translator come in the room with you, and talking to a translator and them relaying the information to the patient was something that was difficult at first, but I actually experienced more often than not in my practice because my practice was very multicultural. So really good experience trying to do that. And I'm noticing now while I'm in the hospital that it's actually more common than you think being in Ireland. So that was my last really cool experience. Now, that wraps up part 2 of this general practice series. If you guys enjoyed, please subscribe, toss a thumbs up. See you in the next one.